2, 1. Okay, guys, we're going to do chapter 13, and that is the male reproductive system. So let's get to it. And here we are. All right. So what we're going to talk about tonight is the structure and function. So the man has testes in the scrotum, and that is where sperm is made. And sperm are, the male sex cell. They also secrete testosterone, which is the male hormone that makes a man, okay? The epididymis is on top of the testes, kind of like a storage place for sperm, right? So like right there. The vas deferens are like the little tubes that transport the sperm from the epididymis to the ejaculatory duct. Right? The seminal vesicle provides nutrients to support the sperm, which is semen. 60% of the seminal fluid ejaculated during intercourse is the semen, and then about 40% is the sperm. And there's millions of those little guys all trying to get to the egg. The ejaculatory duct is the duct where the semen enters the urethra. And the bulbourethral glands, they produce this kind of alkaline fluid that keeps the sperm alive, because once they get into the vagina, it's a very different pH. So that's how they can stay alive and start swimming for their lives. The prostate gland, and I'm going to go back to this picture for a minute, because when I ask my nursing students, it always cracks me up. Where is the prostate gland? Prostate gland is right here. So it's under the urinary bladder, right? And the urethra runs kind of right over it or through it. And so when men get older, sometimes that prostate will swell up, and it can cause problems with urination. So, and what does the prostate gland do? That makes this alkaline substance also that protects the sperm once they get into that acidic environment in the vagina. And then the penis, organ of copulation composed of erectile tissue, encloses the urethra, the structure that expels urine and semen from the body. I think everybody should be pretty clear on that. Okay. So what is the purpose of the male reproductive system? I love these PowerPoints. What is it? To reproduce, right? Right? Deliver sperm so that you can make babies. And what are the sperm transporting structures? Anybody want to take a stab at it? Epididymis, the vas deferens, the ejaculatory duct, right? Okay. Accessory glands would be the seminal vesicles, bulbourethral glands, and the prostate. And the copulatory organ, come on, you guys all know what the organ is of the male reproductive system.
The penis.
The penis, there we go. All right. So here we're going to list the combining forms for these words. So the first one is glands of the penis, which is balano. The epididymis is epididymo, which is a tongue twister, really. Epididymo. The vas deferens, a duct or a vessel. Believe it or not, vaso. I don't know why these are so tiny. Because it's like a vessel or a tube or a duct, right? And then the prostate gland would be prostato or prostato. Okay. Seminal vesicle is vesiculo. Male, andro. I don't know if you guys knew that. The perineum, also known as the taint, the area between the scrotum or the vulva with the female and the anus. And that word would be perineo. And the testes, believe it or not, anybody know this one? It's orchi. If someone has a testes removed, it's an orchiectomy. So orchi, oops, it can also be spelled orco or it can also be called testo. Okay, because it's not confusing enough. We'll give you three different. If something is hidden, it's cryptic, right? So crypto, like cryptocurrency. And sperm cells, and referring to sperm cells, would be spermato or spermo, which sounds silly. A dilated vein is varico, like a varicose vein. And the gonads, which are the sex glands, gonado. Sounds like a foreign language. Okay. I am not going to go through all of these with you guys. Let me move on. Okay, let's see if we can do these together, building the medical words, right? So the prostate, prostato, right? So what is enlargement of something? Remember when we did cardiac?
Megaly.
Megaly, right? So there you go. So prostatomegaly. Very good. Beautiful. If the epididymis is inflamed or irritated, they would have, what would they have?
Epididymitis.
You got it, Sissy. Epididymitis. Destruction of sperm. If we destroy something, everybody remember lysis or hemolysis would be destruction of red blood cells. So if we're destroying sperm, spermatolysis. Okay. And if we excise something, excision of part of the vas deferens. What's excision? Is an ectomy. So, right. What do guys get when they don't want to have any more kids?
Vasectomy.
There you go. See how easy that was? Make room here. My goodness. A vasectomy. If something is resembling a male, and male is andro, resembling it would be, anybody want to take a guess? It's a lot of people have this as a phone.
Android.
There you go, right? Somebody has a hernia of the glands of the penis, which is rare, by the way. I'm just going to do this one. It's a balanocele, right? If they have something wrong with their gonads, when something is wrong, pathos, meaning something, it's not working right, what would it be?
Is it hyper gon?
So pathos, pathy, gonadopathy, right? Whenever there's something wrong with something, you want to think about apathy, right? Pathophysiology. How about if somebody has a stone in the prostate? What were stones?
Lith.
Right, so prostatolith. Prostatolith. There you go, good. And pertaining to producing maleness, so something that makes a guy a guy. So androgenic, right? And if it's pertaining to sperm, what would that be? Spermic. Tell me you're not having fun. All right, sexually transmitted diseases. There are lots of them. Back in the day, it was good because there were only, syphilis and gonorrhea and crabs. Now it's so many things. There's chlamydia, HIV. They really can be dangerous. Everybody knows how dangerous HIV is, but people don't think about some of the other ones that really can cause, like syphilis, for example, can cause neurological damage in people, loss of hearing, right? They can cause loss of fertility, the ability to never have children, right? There's gonorrhea, signs and symptoms. And the treatment for gonorrhea and syphilis is just antibiotics, and the same with chlamydia, But then there's herpes, and that's the gift that keeps on giving. Genital herpes is in the herpes zoster family, herpes simplex family rather, but once you have it, you have it. And the actual eruptions can come and go. So they're transient, very painful. And just fun fact, you can actually pass on genital herpes even if you don't have an outbreak going on. So use a condom. Genital warts, which are also fun. And certain strains of these are associated with cervical cancer in women and penile cancer in men. So the human papillomavirus is one of the viruses that can cause genital warts. And probably most of you got the HPV shot, I'm guessing. There's the vaccines. Here we go. I'm not going to go through the case studies. All right, diseases and conditions. Oh, this is what I was talking about earlier. It's called benign prostatic hyperplasia. So what does benign mean? If something is benign?
It's
Non-cancerous.
Non-cancerous or harmless. In other words, it's not going to kill you, right? Very good. So benign prostatic of the prostate, hyperplasia. That's just an overgrowth or a swelling of the prostate. And when that happens, and this typically happens with older gentlemen, they will have difficulty starting the flow of urine, maintaining the flow of urine. They'll complain like, I try to go and it drip, 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 and very, very uncomfortable. We can treat it medically with medications, tamsulosin and those kinds of things, or we can do something called a TURP, which is a transurethral resection of the prostate gland, where they go right through the urethra with a small tool and kind of shave the prostate down, make it smaller so that it's not causing so much problem. Then there's prostate cancer. That's a problem. Runs in families. There's a genetic predisposition to it. If it's not caught in time, it's a problem because it can metastasize to the pelvis and the bones. And once that happens, it's kind of a wrap. There are signs and symptoms like dysuria, painful urination, blood in the urine, hematuria, peeing at night, hesitancy, erectile dysfunction or painful ejaculation. This, like with any cancer, the sooner it's diagnosed and treated, the better the prognosis is. There's something called a PSA, prostatic specific antigen. It's a blood test that we do that can give us kind of a heads up as to whether somebody is at risk. Usually people don't have symptoms until it has metastasized, which that's a problem. All right. Oh, what's a circumcision? Oh, come on. You guys know what a circumcision is.
Removal of the foreskin of the
Yeah.
penis.
There you go. Removal of the foreskin of the penis. And it can be done for hygienic reasons. It can be done for religious reasons, lots of different reasons. Epispadias, that's a nasty congenital defect. That I'll tell you. So it's a malformation where the urethra, instead of being at the tip of the penis where it's supposed to be, is somewhere else. It can be on the bottom part of the penis. It can be, the closer to the scrotum it is, the worse it is, and the more difficult it is to surgically repair. So it's an abnormal malformation of the urethra. And then erectile dysfunction, everybody knows that. That means that you and your partner are sitting in separate bathtubs watching the moon, just like the Cialis commercials. So no, it's the inability to achieve an erection. Inability or maintain. Achieve or maintain erection. All right, let's see. Hydrocele, who wants to take a stab at that? So hydro is water or fluid, and seal is a hernia, right? So a hydrocele is actually a hernia it's a fluid-filled sac that like around the testes. If anybody's ever known anyone or seen anyone that has had one of these, they'll have one testicle that's way bigger than the other. Okay, so fluid-filled sac around testes. Hypospadias. Now remember what, when we talk about spadias, it was a malformation of the urethra, right? So what do you think hypospadias is? What's hypo? If something's hypo, it's too what?
low,
Low.
Too low or too small, under, right? So with hypospadias, the urethra it's a malformation, urethral malformation that it's too small. And then sterility, if somebody is sterile, that means they can't have children. So the inability to produce offspring. Okay. Procedures. Oh, there's the Turk that I was talking about, the transurethral resection of the prostate, where they go in through the urethra and basically shave down the prostate to make it a little smaller. So this way they don't have as many problems. There are some pictures of vasectomies, and they can also do a reversal of a vasectomy, which is a vasovasotomy. Isn't that fun? Fun word. And we're not doing the case studies. I believe that we are almost done. Okay, procedures, ultrasound. Again, we can do an ultrasound of almost any body part. It's where we're going to insert an ultrasound probe called a transducer into the rectum to really go in and take a look at that prostate gland to see, you know, if we think that there's cancer, or if they had cancer and they were treated for it, did it work? Was that treatment effective? We can also get a biopsy of the prostate. Let's see. Brachytherapy, radiation oncology. This is where they make you radioactive. They do. They take radioactive seeds, they're called, and they surgically implant them right next to the prostate where the tumor is. And you're radioactive while they're inside of you, but they shrink the tumor, hopefully. Digital rectal exam, all men love this. No, I'm kidding. When men get older, we can palpate the prostate through the rectum to see if it's swollen or if there's anything abnormal, in the way that it feels, which can give us like a predictor of cancer. Semen analysis to see how many little swimmers a man has, the quality of them also to see if he's able to, have children, or we can do one to make sure the vasectomy worked and that there aren't any swimmers. I talked about the blood test. So yeah, we are almost done. Fixation of the testes in the scrotum. So remember what the beginning of that word, it was orchio, right? Orchiopexy. A suture of the perineum. Perineopathy. Forming an opening between the vas deferens and the epididymis. Vasoepididymiostomy. How do you like that one? That's a mouthful. Vasoepidydymiostomy. There we go. And a surgical repair of the glands of the penis is, remember, surgical repair is plasty, so balinoplasty. Okay, and excision of the vas deferens if he doesn't want to have any more kids, vasectomy. Removal of the epididymis is an epididymectomy. Epididymectomy. An incision to remove a stone in the prostate gland is prostatolithotomy. Prostatolithotomy. Record of the seminal vesicle, which I have never heard of, but it's a vesiculogram. And let's see what we got. We're not getting into the pharmacology, right? And the case studies. And I do believe that we are through. So again, what happens here is the words that you've already learned, we're just kind of adding to them because plasty and ectomy and ostomy. So now we're just using them with different other words, making these combining forms appropriate for different body systems, right? I'm going to stop recording to see if anyone has any questions.